What are the chances of kidney cancer returning after partial nephrectomy? Imagine having a small kidney tumor removed and wondering what the future holds. The good news is that most patients who undergo a partial nephrectomy have a very low chance of the cancer coming back. Studies show that the recurrence rate after this surgery generally falls between about 2 and 9%. This means that in most cases, the cancer stays away, especially when the tumor is caught early and treated properly. Partial nephrectomy, also called nephron-sparing surgery, involves removing only the part of the kidney that contains the tumor. The rest of the kidney is left intact, which helps preserve kidney function. This approach is often used for small tumors, usually classified as stage T1, where the cancer is confined to the kidney and has not spread. Because the surgery focuses on just the cancerous part, the risk of recurrence depends on several factors like tumor size, grade, and how advanced it was when diagnosed. Most studies report that the chance of the cancer returning within 2 to 6 years after surgery is quite low. For example, some research shows recurrence rates around 2 to 4% during this period. In one study involving robotic partial nephrectomy, the recurrence rate was about 2.9% over roughly 31 months. Another large group of patients had a recurrence rate of about 2.3% after about 3 years. While some reports mention local recurrences up to 9%, these are less common and often linked to larger or more aggressive tumors. Most recurrences happen within the first 2 to 3 years after surgery, but some can occur even after 5 or 6 years. That's why ongoing follow-up is so important. Regular imaging tests like CORT scans or MRIs every 6 to 12 months initially, then annually, help catch any signs of returning cancer early. Recurrence can show up in different ways. It might be local, meaning at the site where the tumor was removed, or it could be regional, involving nearby lymph nodes. In rare cases, the cancer can spread to other parts of the body, such as the lungs or bones. Sometimes, new tumors can develop in the opposite kidney, but this is less common. The risk of recurrence tends to be higher if the tumor was more advanced, larger, or had a higher grade when diagnosed. Tumors close to critical kidney structures, or those with certain features, may also increase the chance of the cancer returning. Surgical factors like longer operation times or blood transfusions might influence outcomes, but overall, the risk remains low. Compared to removing the entire kidney, partial nephrectomy offers similar control over the cancer. The main benefit is that it preserves kidney function, which is important for overall health. Because of this, doctors recommend careful follow-up after surgery to monitor for any signs of recurrence. In summary, most patients who have a partial nephrectomy for localized kidney cancer have a very good chance of staying cancer-free. The risk of recurrence is generally under 5%, depending on tumor characteristics and surgical details. Regular checkups and imaging are essential to catch any issues early and ensure the best possible outcome. If you or a loved one are considering this surgery, talking with your healthcare team about personalized follow-up plans can help provide peace of mind and the best care possible.